I saw my first patient on July 1st, 1981, on my first day as a faculty member at San Francisco General Hospital. You go through medical training expecting to have incremental advances, but nothing really prepares you in your training to see something brand new. There were a number of barriers to care in the early days. I think the fact that we didn't know what we were doing was one. I think medical care at that point was really appallingly ignorant of gay men and lesbians, something that no one was thinking about. And to some degree, the stigma of the patients transferred on the providers, on those of us that were taking care of them, because many medical centers didn't necessarily want AIDS patients around, both because of the stigma of the background and also because of fear of the disease. So the hospital responded as the General always has. It's got an amazing heart, and it responded to the polio epidemic, to the tuberculosis cases, and in this case to the AIDS epidemic, without ever looking back. I think it was just, of course we're going to do this. The standard of care in the first part of the epidemic, before we had any drugs, before we even knew about HIV, was to help our patients understand what they were going through. So palliative care, really, for the first couple years of the epidemic. As we began to understand more, it was clear that this was a new disease, but had no way of knowing how big this epidemic would become. In fact, it was already a giant epidemic in San Francisco when I saw that first patient. The virus had already spread through the community. I think when people wonder about the emotional part of AIDS care in the early days, they think first of all of the fear. But actually, it wasn't a fearful thing at all from the start, because we didn't really think of this as an infectious disease until somewhat later. So before that, it was really mostly excitement, a new aspect of medicine, of taking care of people with diseases that we didn't understand.